I certainly oppose privatizing of Social Security. I've been against this since I ran in 1996. I make a commitment to seniors, whether it's election or non-election, that I will never vote for the privatization of Social Security. What would have happened if we would have had some of our Social Security money invested in Wall Street? And mind you, 25% of American people depend upon Social Security as their main source of income. What are you telling those people? What are you going to say to those people? I think Social Security is solid for the next 25 years. We're going to work on ways to do it. I am not so sure that I would support extending the age, because they already did that some years ago. We are almost up to age 67. I wouldn't extend it to 69 or 70. I would be very hesitant. That would not be one of my first resorts to do that particular thing. I would not raise the Social Security tax. I don't think that's the way to go. I would take a look at when we had bipartisan support for this, by the way, 3-4 years ago, and to look at that cap that we placed on income up to, that is taxed up to, I think it's $107,000. We need to take a look at that. I think that's a bit archaic. That's something that we could take a look at. There's no question in my mind about it. As for Medicare, we've extended its life 10 years with the health care bill, and we are looking at it very closely. We remember, it's an insurance policy. This is an insurance policy, and you pay for it before you get the benefits. So you're paying into it. So we will extend Medicare for at least a few decades, and we are working on it. The commission's going to be reporting both on Social Security and Medicare to the Congress. We'll see what courage is needed to vote on these decisions. I think Medicare is important for the American people. It is not by any stretch of the imagination socialized medicine. We pay into these things. We pay taxes. And this is a benefit to us in our older age, when we're 65 and older. And I think it's important. Just like Social Security is not just for older people like myself, it's for a lot of kids who come from families where there's dysfunction, there's physical hurt, there's sickness. These things are very important to the well-being and the common good in the United States of America. So I would take a very close look at what the commissions report to us, but I know that we've extended Medicare for at least 10 years in the health care bill because of what we've done and because of how we've kind of evened off things with these, for instance, Medicare Advantage, which costs us 14-15% more to administer, and we all pay it, even though we don't have it. We all pay into the system. And I think that we're going to be fine with Social Security and Medicare. We need to address it. We can't kick the can down the road any longer. On a lot of things, we can't kick the can down. And we cannot impose upon the deficit. And these are entitlements. These are entitlements. So they need to be addressed in a very different way than the daily to day-to-day budgets, which is the general budget that we vote on, 13 appropriations.